The recent advancements of NMOSD treatments have entirely changed both the landscape of the disease itself, but also patient care, how, the outcomes associated with our health in so many different ways. So I'll just use a personal anecdote. In 2014, when I was diagnosed with NMO, there were no available therapies. So getting diagnosed with NMO 10 years ago even was a drastically different experience. It was almost like a death sentence in some ways. We were resorting to off-label therapies, some that were not very efficacious. The prognosis was not great. And I think that contributes to a lot of mental health challenges that come with being sick. And of course, if a drug isn't working great, the health outcomes are not going to be great. So in essence, the patient is kind of left depressed, not motivated, and just kind of in despair, I would say. But now we have 4 FDA-approved therapies, and they work really, really well. So when patients get diagnosed now, they're hopefully getting diagnosed quickly and correctly, but they also have treatment options that work for them and that are proven to work. The other thing I want to say too is in a rare disease, having treatment options is a luxury that many rare disease patients don't have. So naturally, you feel a sense of empowerment as a patient when you're like, okay, I can work with my doctor, talk to my family, and even discuss with myself what factors of getting a treatment are important to me because I have options to choose from. Whether it's drug delivery method that's important to you, or side effects that's important to you, or infusion schedule that's important to you, NMOSD patients now have options. And this means, in essence, with higher efficacy, better health outcomes, better mental health, more inspiration, more motivation to keep fighting the good fight. So I don't think NMOSD anymore is this like deadly diagnosis, and that's largely due to all of the advancements that we've had in all of these treatments and I would say diagnostics. Now, that being said, it's so great that we have all of these treatments that have been approved, but we still have a lot of challenges, getting it to be accessible to patients. They're very, very expensive drugs, and there's constant hurdles and battles with insurance companies. So even if you're aquaporin 4 positive, even if your doctor prescribes these medications, sometimes it is still very challenging to access them. So we need to work on accessibility of these drugs. Additionally, unfortunately, I think that there is still a school of thought out there that some of the older off-label therapies are a better option for the patients, like very archaic medications that have proven to not be as helpful to patients, which is unfortunate when there are therapies out there for NMOSD. So I want to make sure that we're continuing these conversations about the treatments, of course, being available. That's a huge milestone and great progress. But let's keep working towards making sure clinicians are aware of these drugs, are prescribing these drugs, or at least giving the patients the option to get them, as well as making them accessible.